Hi, and welcome to Transparent with Tina. Today's guest is a renowned heart surgeon, a four-time New York Times bestselling author, a physician, scientist. He's also the leading expert on the lectin-free diet as a key to reversing disease and boosting longevity, as explained in his 2017 book, The Plant Paradox. In his second breakout book, The Longevity Paradox, How to Die Young at a Ripe Old Age, he provides an innovative plan as to actually get younger as you age. He also has the Plant Paradox Family Cookbook, and in 2021 will be releasing his newest book, The Energy Paradox. He practices medicine 7 days a week at his two waitlist-only clinics, the International Heart and Lung Institute in Palm Springs and the Restorative Medicine in Santa Barbara, California. He's also co-founder of Gundry MD, a wellness brand and supplement line. Please welcome Dr. Stephen Gundry. Welcome. Wow, that was a lot to get out. And normally I can memorize it, but there's just too much to memorize. And
I'm exhausted already. Thanks.
Yeah, and I'm sitting there as I'm reading this, and 7 days a week, and writing all these books. When do you sleep? I mean, do you have time to sleep? Are you like one of these people that sleeps maybe 3 hours a night?
I have a normal sleep habit. So I just, everybody says, gosh, you just turned 70 years old. Why don't you stop seeing patients? And the answer is, as I've talked about in all my books, I learn from my patients. When I started this 20 odd years ago now, I viewed what we were going to do as a research project, because I was a researcher all my life, still am. And so we wanted to find out what would happen if we took certain foods away from people or asked them to go get supplements at Costco or Trader Joe's. This was before the days of Amazon. And lo and behold, we found and published a great deal that, son of a gun, speaking of lectins, we found out that lectins in plants are pretty mischievous in our current diet.
Well, okay, we're definitely getting into that, and we don't have a lot of time. But I interviewed you 7 years ago when I read your book, The Diet Evolution.
Yeah.
And I had cancer at the time, and it was honestly I had read 3 books, and yours was one of them. And it was one of the reasons why I chose not to get radiation, and I'm cancer-free 12 years later. So I'm so happy that I read that. So I've been a fan of yours ever since, and that was 7 years ago. Just share a little bit of a story, because you are a renowned heart surgeon. You and your partner at the time did more pediatric heart plant surgeries than any other doctors in the world.
Yeah, my late partner, Leonard Bailey, and I pioneered infant and pediatric heart transplantation. He just actually passed away a few months ago, unfortunately.
Oh, I'm sorry.
So I guess I'm now the world leader in it, but by default, which is very unfortunate, because he was just an amazing individual. But
yeah.
So over 20 years ago, I now know that I met a guy who I call Big Ed in the Plant Paradox.
Mm-hmm.
Who changed my life in realizing that you could reverse heart disease, inoperable heart disease, with food and supplements, and kind of blew me away, because I was certainly taught that was impossible. And so after experimenting on myself and losing 70 pounds and trying it on patients at Loma Linda University, where I was chairman of heart surgery, who I would operate on, then teach them this program, I realized that I was doing things backwards, that I could teach people how to eat and not operate on them. And that was, really a dumb career move, if you think about it. Because,
yeah, but you're going to be helping a lot of people this way.
Yeah, and again, that's why I actually keep doing this, because I'm still like a kid in a candy store.
Yeah, and you're always learning. That's why I love what I do. Every person that I interview, it's of interest to me, and I learn, and I can spread your message to everybody. And same thing with you. And so you had your own struggles with weight, and so that was one, because I remember Big Ed, because we had talked about that, and his markers were so high, you weren't even going to do the surgery. And so that's
right.
you got interested in that, but tell us the lectins. I mean, I am listening to the plant paradox, and I got to tell you, it's difficult for me to articulate it. I'm ingesting it, but one thing I thought was, I think everybody should know first, is your digestive tract. When you say that it's outside of you, although it's inside of you, and you say that it's like if you're driving through a tunnel. So I thought that was fascinating. So anything that's going through your mouth all the way out through your colon is separate from your body, right? And this is where this all happens. This is where disease happens in the lectins. So why don't you go ahead and take it from there and tell us kind of the process of what happens.
Yeah, it's interesting. Hippocrates, 2,500 years ago, said that all disease begins in the gut. And, he didn't have the Human Microbiome Project. He didn't have colonoscopes. He didn't have any of this. And yet he predicted. He was right. He literally was absolutely correct that all disease begins in the gut. And one of the things I was had on my podcast recently, the former head of the FDA, who we were taught, doctors of my ilk, were taught that basically the intestines were a hollow tube, and all you did was absorb proteins, fats, and carbohydrates, and then whatever was left over was pooped out your rear end. And that's kind of what we were taught. And what we now know is that rather than being this kind of hollow tube, it houses a complex rainforest ecosystem of bacteria and fungi and viruses and worms that constitutes a separate but equal organism within us. And so we have a symbiotic relationship with the bugs, if you will, that live in our gut. And one of the things that those bugs do is they defend us and actually eat many of mischievous plant compounds that plants use to protect themselves and their seeds, which are their babies, against being eaten. And again, it's a hard concept to think about that a plant doesn't want to be eaten. The plant has these same needs to survive and grow and propagate that animals do.
Exactly. That's how you put it in. Yeah, that's easy to digest, because an animal has, let's say, a porcupine. It's not going to be eaten. Same thing. So they don't want to be eaten either. They're part of the natural kingdom.
Yeah. So speaking of porcupines, so plants, one of the defense systems that they use are a protein that are called lectins. Mm-hmm. And you couldn't have picked a better example than a porcupine to think about what a lectin is like to our insides. Because these are sticky proteins that look for particular sugar molecules that line the lining of our gut. They line our mouth, they line our swallowing tube, they actually line our joint spaces, they line our blood vessels. That's how I got interested in them. And they line the spaces between nerves where one nerve talks to another. And they are great about causing leaky gut. And if you had asked me even 15 years ago what I thought about leaky gut, I would have told you it was voodoo and pseudoscience. But now we have wonderful tests that can show that almost every human being with any disease has leaky gut. And a lot of this was thanks to Dr. Fasano, who's now at Harvard, he was at Johns Hopkins, who proved that gluten, which happens to be a lectin, is perfect at causing leaky gut.
So leaky gut is when what happens?
So normally, our intestinal surface is the same surface area as a tennis court inside of us. And
please explain that, because I heard that and I didn't quite digest that.
So literally inside of you, if we took all, your intestine is actually a shag carpet. And we have all these little roots called microvilli. And those microvilli are so numerous that if we spread out the entire surface area of our intestines, it would be the same surface area as a tennis court.
Interesting.
And what's fascinating is these cells that line our gut is only one cell thick. There's only one cell between everything that we swallow and all those 100 trillion microbiome bacteria, between everything we swallow, including lectins, and us. And when you think about it, that's kind of
like our protective wall.
Yeah, and it's only one cell thick. And what a dumb design.
I was gonna say the same thing. Wow.
Well, so we have to have. It's a dumb design, but a great design, because we have to get sugars and proteins and fats across this.
Okay, right. It can't be too difficult. Yeah.
Right. But so we have to have other ways to protect this wall. And we have a mucus layer that I talk about that's been eroded. We have a microbiome that likes to eat lectins. And believe it or not, there's even a bug that enjoys eating gluten. But one of the principles of the plant paradox was that we have had a number of what I call deadly disruptors that have made our defense systems just porous. And they are, among other things, antibiotics. Antibiotics were miraculous. When broad spectrum antibiotics came out in the mid-1970s, we thought, doctors thought we had died and gone to heaven, because we could give somebody a pill to swallow that would basically kill every known bacteria, and we didn't have to guess which one was causing a patient's problem.
Mm-hmm.
What we didn't know was, besides killing the bacteria that we thought was causing the patient's problem, it killed off all the bacteria in our ecosystem in our gut. So
kind of like the same thing as chemotherapy or radiation. Kills the bad, but also kills, right?
Yeah, exactly.
Same idea. Okay.
The other problem is that the vast majority of antibiotics aren't given to humans. They're actually given to animals that we eat. And they're given to animals primarily to make them grow faster. And so when we eat those animals, they have traces of antibiotics in their flesh. And so those antibiotics go into us as well. So we don't even have to swallow them anymore. We're swallowing animals that have them.
We're eating them, yes.
So, normally we should have maybe so far about 10,000 different species of bacteria in our gut.
Mm-hmm.
But after one round of antibiotics for, say, like, a urinary tract infection, or even, a cold that your doctor said, oh, I'm going to give you antibiotic, that can be reduced to 1 or 2 species. And there's some papers that show it may take 2 years.
Yes. That's just, and that's antibiotics. You also went on to say, like, for example, Advil. Okay, that was what 1972. You said that you needed a prescription for that.
It's true. Yeah.
Okay. And that can also wipe out how much?
So what Advil does? Advil is like ibuprofen, is like, or naproxen, Aleve, like swallowing a hand grenade.
Right.
And the reason, so it blows holes in this wall. It actually creates craters. And I can't tell you the number, and I talk about it in the plant paradox, the number of patients I see, young patients with an autoimmune disease, say like lupus or rheumatoid arthritis or Crohn's, who were athletes who had an injury, and they were put on high-dose Advil or Aleve, and all of a sudden, out of the blue, they develop an autoimmune disease. And it's like, what the heck? I'm so healthy. Where'd that come from? And it was because they had literally blown holes in the wall of their gut. And that started the autoimmune disease that I talk about in the books.
Yes. My niece actually has Hashimoto's, which is an autoimmune disease. So that would be a number one way of blowing a hole through the gut, right? But
really
then you have How else does that happen?
Oh, lectins are really, great for causing leaky gut. I mean, probably my most famous example is Kelly Clarkson, who had Hashimoto's, and somebody gave her my book, and she started following it. She actually was not a patient, is not a patient, and she was on thyroid medication. She had markers for Hashimoto's. All those markers went away. Her Hashimoto's went away. She lost 30 pounds in the process. And I mean, that's exactly what we see in 94% of patients, and I've published this. In 6 months' time, if we remove lectins from their diet and take away these disruptors, then 94% of people will be off of their immunosuppressant meds, and they'll be negative for their biomarkers for autoimmune disease.
And you see that our cells turn over every 90 days.
Correct.
So if they started practicing the plant paradox, but it would still take 6 months, it wouldn't be 90 days.
No, in other words, the paper was, let's see what happens in 6 months' time.
Okay.
So we do a lot of markers for leaky gut, and we check every 3 months. And most people, their leaky gut can go away in 3 months.
Oh, I didn't realize that. Leaky gut can go away.
Oh yeah, better.
What are some of the symptoms of leaky gut? What'd you say?
Better, or else I have no business doing what I'm doing. Yeah, I mean, leaky gut is completely fixable.
And what are some of the symptoms if somebody doesn't know they have?
So if you have a disease process, you have leaky gut. So for instance, migraine headaches. I used to get migraines doing operations on newborn babies. I don't recommend that. I don't have migraine. I haven't had a migraine in 20 years now. High blood pressure is caused by leaky gut. Heart disease is caused by leaky gut. It's not a cholesterol problem. It's a leaky gut problem. You name the problem. Anxiety and depression is caused by leaky gut.
That was one of my questions. So mentally, it affects you too.
Correct. For instance, the one you brought up was a gentleman who had diabetes. He had a heart attack. We were scheduling him for open heart surgery for 5-vessel bypass. In the pre-op room, I always check in and say, how we're doing. He says, I don't think I can go through with this. I'm scared to death. I'm not going to come through this. Is there any other way? And I said, well, yeah, absolutely. If you follow what I ask you to do, I can guarantee you that I'll never operate on you. He says, I'll do anything. So we did. And we just actually celebrated our 12th year without me operating on him. He's now in his mid-70s. He's no longer diabetic. He's on no medications. He passes his stress test with flying colors, and we just kind of chuckle, every year when I see him. I said, doggone it, I could have made some great money on you, and now look, nothing.
So let's talk about some of the foods. By the way, I just want to let you know that I have been on your diet for 3.5 weeks or something. What I noticed, I was having fruit shakes, smoothies every day with acai, with berries, no bananas, but I would feel like there was rocks in my stomach all day long. So that's one of the no-nos is fruits. Now, is it all fruits, or is it just the fruits with the seeds, or is it pretty much, it sounds like it's pretty much all fruits, right?
So, in my original book, one of my sayings was give fruit the boot. And don't get me wrong, I think fruit is fantastic, but our problem is, long ago, we only had fruit once a year when it ripened in the summer, and it ripened locally. And fruit that's ripened on a tree, it turns out fruit that's immature has a lot of lectins in it because the plant doesn't want you eating its fruit until it's ripe when the seeds are protected. And the plant actually tells you when the right time is because it changes color.
Yes.
And we're one of the few animals that has color vision, because the only animals with color vision are fruit predators, and the plant signals us. So most fruit, unfortunately, now is picked in off season and in Mexico or Chile or Argentina, and shipped green and then ripened with ethylene oxide. And so a fruit is not a fruit anymore in that respect. The other thing that's very hard to convince people of, and this was my research as an undergraduate at Yale, all great apes only gain weight during fruit season. And fruit only ripens once a year, even in the jungle. They do that because in the absence of fruit in the winter, there's always a time where there's less food, whether it's a dry season, a rainy season, a cold season. So we're a great ape, and we use fruit to gain weight for the winter. And now winter never comes. We have 365 days of endless fruit summer. And in the next book, The Energy Paradox, I have a lot of critics, but the evidence that fructose, the sugar in fruit, is really mischievous for energy production, for causing high blood pressure, for causing fatty liver, and give fruit the boot.
The thick-skinned produce, such as bananas and oranges, are they okay to eat if they're not organic?
So a banana, if it's eaten green, is full of prebiotic fiber, what gut bugs want to eat. Mm-hmm. If you ripen a banana, it becomes one of the highest fructose-laden foods there is, right ahead of grapes. And, recently I once again called grapes sugar bombs, and they are. And they have been bred for size and sweetness. It's the same way with blueberries. When I was growing up, blueberries were these little bitter things, and you had to pour a half a cup of sugar on them to make them edible. But now they've been bred for sweetness. And now, they're the size of grapes. And blueberries, which used to be a great health food, have now become one of the highest sugar content of all the fruits, just from our hybridization.
Right.
So if you're going to have a fruit, the safest are raspberries.
Okay.
Second are blackberries, and third are strawberries. Oh. But again, most strawberries, unless they are organic, just stay so far away from them because the number of fungicides and herbicides that are applied to, and insecticides that are applied to strawberries would scare you to death.
Let's talk about stomach acid here for a minute, because you can have too little, right? And you can have too much. So tell us the difference between the two.
Never met anybody who had too much stomach acid. Who would that be?
Really? Yeah, because I had too little. So why do you think that I would have too little?
Well, so who told you had too little?
A doctor.
And how did he measure that?
Blood test. Well, blood, stool, and saliva.
You can't tell how much acid.
You know what? It was interesting because they said, I think you're too alkaline. And I didn't think that was possible. Is that possible to be too alkaline?
So the whole theory of alkaline base balance doesn't actually hold water very well, to use an expression. Sorry about that.
Mm-hmm. Okay.
And it has nothing to do with stomach acid and very little to do with acid or alkaline foods. We are far more protected against the foods we eat than having a, quote, alkaline diet or having a acid diet. In fact, on one of my podcasts, we had one of the world experts on hydrogen water and alkaline water. Mm-hmm. And he brought up the fact that alkaline water has absolutely no buffering capacity at all. And if there was such a thing as needing to buffer, then alkaline water ought to have amazing buffering capacities. And in fact, it has none whatsoever. Now, taking bicarbonate, sodium bicarb, has phenomenal buffering capacity, but not alkaline water. And so much of what happened.
Sodium bicarbonate, which would be in layman's
Baking
terms.
soda.
Pardon me?
Baking soda.
Okay, that's what I thought you meant. Okay, all right. So that I've heard great things about. Yeah. So you would take that just.
Yeah, I mean, there's some, and I actually have some references in the book about you can change, for instance, the inflammation in your gut by a dose of baking soda.
Okay.
But sorry, alkaline water won't do it.
Okay, and how would you increase your stomach acid?
So you don't need to do anything to increase your stomach acid normally. That's why I asked you. There are a few people with what's called hypochlorhydria, but you have to actually have a pH probe in your stomach to prove that. My guess is you didn't swallow a pH probe to prove it.
No, I didn't.
And remember, as a cardiothoracic surgeon, I was an esophageal surgeon and worked on people with heartburn and GERD, and we used acid probes to see who actually had acid in their stomach and who didn't have acid in their stomach. And we found that 99% of people have absolutely normal acid production in their stomach.
Okay.
Okay.
What about Candida? Can Candida cause leaky gut?
Great question. So we do see people, Candida candida is a normal fungi that lives in us, on us, in our gut. Mm-hmm. And it, like all other species, are kept in their place. If you take a round of antibiotics kill bacteria, but they don't kill fungi. And so Candida can proliferate in the absence of the other guys keeping them in their place. Mm-hmm. Other problem with fructose, fruit, is that fungi, absolutely, yeast love fructose. That's, just think about it. That's how we ferment apple cider. That's how we ferment wine. And so if you give them their favorite foodstuff, they will be more than happy to grow and populate. Now, I've seen a lot of people with candidiasis, but I've never had to give anybody antifungals. We just took away the foods that they like. And you can't have candidiasis if you're not eating fruit, not eating seeded vegetables. We have to realize that anything with a seed is a fruit. So a bell pepper is a fruit. Cucumber is a fruit.
That's how you do. Yeah. Okay.
A zucchini is a fruit.
But now I think you said, I don't think you said it in your book. I don't know where I'm getting this. But like for a tomato.
Yeah.
You could have, if you take the skin off and you take the seeds out, you can eat the tomato.
If we're trying to avoid lectins, right. The peel and the skin and the seeds have the lectins.
Yeah.
But in so many of my patients, particularly with diabetes or prediabetes or high insulin levels, in all my cancer patients, we've got to, even the pulp of the tomato is still sugar, and we don't allow them to have it.
Okay, I see. What about iodine? It said you were talking about that as the Goldilocks mineral, and that too much can cause hyperthyroidism and too little can cause hypo. Right?
So we have an epidemic of hypothyroidism in this country for two reasons. Number one, we have an epidemic of Hashimoto's thyroiditis, and that's from leaky gut. But we also have an epidemic of hypothyroidism because no one is using iodized salt anymore. We're using pink salt or sea salt, and it doesn't have any iodine. In the early 1900s, we had a literal epidemic of lethal hypothyroidism. Over 10 million Americans died of hypothyroidism. And the federal government, one of the few wonderful things they ever did in health, was to mandate iodine in salt. 26 countries mandate iodine in salt. because we were profoundly deficient in iodine. And I see so many people with hypofunctioning thyroids that all we have to do is get them to buy iodized sea salt, and it's readily available now. Even Morton's makes iodized sea salt, or to add an algae called spirulina to their supplements, and that'll restore the iodine balance. And I mean, it's an easy fix.
Yeah, that's very easy. So what would your, let's say, I mean, your diet, which is explained in the book and obviously the cookbook, right? Anything else besides diet to maintain health and longevity? Anything else that you would say outside of that you're saying in the book?
Well, so the longevity paradox is, exactly how to die young at a ripe old age. And one of the fascinating things that you can actually correlate longevity to is, as long as that wall, that single cell wall, is intact, you're going to have an amazing lifespan, but probably more important, you're going to have an amazing health span.
Yeah.
And that's actually what most of us
Quality
want.
of life.
Correct.
Yeah, because
and so it's like, if you think of a border between countries, Roman Empire or the Great Wall of China, these dynasties fall, these empires fall as the walls disintegrate and the hordes and the barbarians come across.
Mm-hmm.
And you can actually show experimentally that the life of the animal is directly proportional as how long that wall is intact. And as that wall begins to fall apart, the animal begins to fall apart. And so Hippocrates was right. All disease begins in the gut.
In the gut. Okay, and you have a supplement line.
Vital Red was the starter, but it's at Gundry MD.
Yes.
The problem with fruit is not the polyphenols in fruits are some of the most important compounds that anybody could take.
Yes.
But it's the fructose in fruit that's the troublemaker. So I founded my company to get people the polyphenols in fruits with the fructose removed. And so that's actually the original Vital Reds. It was fruit extracts without any fruit.
So that was my question, because I know that the fruits are off limits. So you've extracted that, which makes it safe and beneficial for you.
Correct. GundryMD.com is the supplement website, but people can find me at drgundry.com.
Okay.
And Dr. Gundry podcast every week. And I've got 2 YouTube channels. You can find me on Instagram. I'm everywhere.
Okay. And if there, in regard to supplements, there's so many shiny objects out there. I'm sure you have quite a few. If there was 2 to 3 supplements that you would absolutely say you need to take on a daily basis, not counting your food, just supplements.
First one is vitamin D3. First of all, I've never seen a case of vitamin D toxicity. I've been measuring vitamin D in people every 3 months for over 20 years now. Dr. Mark Hyman has never seen vitamin D toxicity. Recently, Quest and the Cleveland Clinic upped their upper level of vitamin D to 150 nanograms per milliliter. I have run my vitamin D greater than 120 for the last 20 years to prove I'm not dead. Mm-hmm. Vitamin D is incredibly important for keeping the wall of your gut safe. It's also incredibly important for keeping your telomeres, the end caps on chromosomes, long. And it stimulates stem cells in the gut to grow. So it's a win-win-win, and the vast majority of people are vitamin D deficient. In addition, there's now 5 human studies that show low vitamin Ds, bad outcome in COVID, high vitamin Ds, good outcome in COVID and avoiding COVID. Bare minimum, most everyone should be taking is 5,000 international units.
Based on body weight?
Basically, for instance, just had a patient in today. who we finally got her vitamin D level up to 90
Mm-hmm.
with 30,000 international units a day. And that's where she needs to be.
Okay.
Yeah, okay, so that doesn't mean everybody go out and take 30,000 units, but it's amazing how much vitamin D we need. Second is fish oil, omega-3 fats, and there are now plenty of algae-based omega-3 fats so that you don't have, if you're a vegan or a vegetarian, you don't have to take a fish oil-based omega-3. Beautiful studies show the higher the levels of omega-3 in your blood as measured by the omega-3 index, the bigger your brain is as you age and the bigger areas of memory, the hippocampus. So why wouldn't you want, a lot of fish oil in your brain? Particularly anyone who's pregnant. The babies steal 90% of all the DHA, one of the components of fish oil,
Mm-hmm.
from the mother to build their brain. And very good studies show that mothers who supplement with DHA during pregnancy give birth to smarter babies who have better learning abilities. So that's a winner too.
Okay.
Third thing, time-release vitamin C. Vitamin C.
Time release. Okay.
Vitamin C is a water-soluble vitamin that we get rid of every 2 to 3 hours. So we are one of the few animals that don't manufacture vitamin C. And so we need a constant source of it. And get time-release vitamin C, take 1,000 milligrams twice a day. So those are the big three if you're going to supplement.
Okay, I have one more question that I just thought of. You've heard of the bulletproof coffee and the studies that are saying about, because my mom had dementia, that we're not getting enough fats to our brain. Do you think there's any truth to that with the MCT oil, like putting it in the coffee, or coconut oil, or?
So Dave Asprey is a good friend of mine, and so is Dr. Dale Bredesen, who wrote The End of Alzheimer's, who I think is probably the world's leading researcher on dementia. And he's just out with a new book today, The End of Alzheimer's Program, so I'll give it a nice plug. Mm-hmm. So the deal with getting fats to the brain, and you'll see this in the energy paradox, it's not so much getting fats to the brain, but having what's called metabolic flexibility. We have to have our mitochondria, which are the energy-producing organelles in all of our cells, including our neurons, have the ability to shift on a dime between using glucose as a fuel and using free fatty acids as a fuel. Now, interestingly, the brain, free fatty acids can be used by all mitochondria everywhere, but free fatty acids can't get past the blood-brain barrier very well. But another form of fat called ketone bodies can get through the blood-brain barrier. Mm-hmm. MCT oil is one way of making ketones, but we'll make plenty of ketones after 12 hours of not eating. We'll make plenty.
Intermittent fasting.
Correct. That's actually time-restricted feeding. Intermittent fasting is different. So the longer you cannot eat, the better. And
yeah. So wait a minute, what's the difference between, because I thought that it was like 12 hours is good, 14 hours is better.
Right, that's time-restricted eating.
Oh, okay. So that's not intermittent fasting.
No, intermittent fasting is, for instance, the 5-2 diet. You 2 days a week, you only eat 600 calories a day, and the rest of the time you eat normally. Oh. You intermittently fast.
Okay, so everybody's using that. Most people are using that term wrong now.
Yeah, and they're using it, incorrectly.
Okay.
And I do a lot of explaining on that in the energy paradox.
In the energy paradox. Okay. And one more. A friend of mine has polycystic kidney disease. Mm-hmm. Will your diet help with that, or is that just chronic? And
well, so that there is a congenital part of polycystic kidney disease, but we're actually taking care of a number of people with polycystic liver and cystic kidney disease with a ketogenic, lectin-free diet. And knock on wood, we've stabilized these people. They haven't progressed in their kidney disease. And we have one gentleman who's 79 years old and still rides competitively bicycle races of 100 kilometers a day. Not bad.
So we have to slow it. So it's the combination between the keto and your diet. Okay.
Right. At the end of the plant paradox, I mentioned a gentleman who had glioblastoma of the brain, which is really a lethal brain cancer. And he underwent an excision of it, and was, they said, couldn't get the whole thing out, get your affairs in order. He had 3 young children, and he had previously worked with me years before to get rid of prostate cancer with food and diet. And he sheepishly kind of appeared at my office again saying, I'm back, can you help me out? Well, sure enough, his brain cancer not only didn't progress, but it regressed, and you couldn't find it on a PET scan. And I actually, he called me this past weekend and just wanted me to know that it's now 7 years. He just had his last PET scan. He still has no evidence of cancer. His daughter is now quite a nice ballerina at age 13, and his 2 twin sons are 10. And he just called and said, hey, they told me to get my affairs in order. I guess I got my affairs in order. And so it's just a heartwarming story. And one of the things we did was we took his fruit away from him, and he hasn't had a piece of fruit, in 7 years now.
Yeah. No, it was a little bit of an adjustment for me, but not too much. The legumes and the beans, I think, were a little bit harder than the fruit, but otherwise, I pretty much.
Remember, you can pressure cook lentils and beans, and they are perfectly safe.
Oh, if you pressure cook them.
Oh, yeah. And that's actually the Plant Paradox Family Cookbook is all using.
Thank you for telling me. I'm never going to be able to eat.
And, there's a company called Eden that I have no relationship with that pressure cooks, soaks their beans, and then pressure cooks them. And they're in most grocery stores.
Oh.
And beans.
Really? Oh, fantastic. I'm so glad I asked that question. Okay, well, it was a pleasure, and I'd like to have you on again when your new book comes out, The Energy Paradox.
Great, yeah. It'll be out probably late February of 2021, and we just put it to bed the last 2 weeks ago, so now we have to.
Fantastic. Well, you look absolutely amazing, and it was so great seeing you again, and thank you so much for just bringing all this knowledge and helping people.
Yeah, thanks for having me on, and we'll hopefully talk when the next book comes out.
Absolutely. Okay, and thank you for joining us today. We will have all of Dr. Gundry's information for you on the show, and thanks for watching. We'll see you next time.